Good morning, my name is Ma Clarissa Lanuza, and today's presentation will be all about health promotion targeting diabetes mellitus in the Aboriginal and Torres Strait Islander population in Redfern, New South Wales. The slideshow that you will be witnessing is compiled and presented to you by our team members, namely Hak Shazang, Kazal Raj, Sylvia Darshani, and myself. Before we proceed with our presentation, we would like to acknowledge and pay respect to the traditional owners of the land on which we meet, the Darug, Tharawal, and Wiradjuri people. It is upon their ancestral lands that the Western Sydney University is built. We also pay respect to the knowledge inculcated forever within the Aboriginal custodianship of this country, as we share our knowledge and research practices within this university. This presentation will be delivered to you in this order. I will be discussing to you the overview of urban population, diabetes mellitus, and health promotion. Haksha will be in charge of presenting the linking culture and health of Aboriginal and Torres Strait Islanders. Kazal will be in charge of discussing to you the social determinants of health in the Aboriginal and Torres Strait Islander individual with diabetes mellitus. And lastly, Sylvia will be discussing to you the cultural competence and safe practice in Aboriginal and Torres Strait Islanders with diabetes mellitus in a nursing context. We have chosen the urban section, particularly the Redfern, New South Wales, as the healthcare context of our presentation. Based on statistics, over 60% of Aboriginal and Torres Strait Islander people live in capital cities or regional centers, and 62% of this population is affected by diabetes mellitus. Redfern, New South Wales, as the focal point of our research, has statistics of 13,213 in total population, and 2.1% of this population is comprised of Aboriginal and Torres Strait Islander people. According to Aboriginal Medical Service in Redfern, the number of Aboriginal and Torres Strait Islander patients with type 2 diabetes aged over 50 years is 312. Which covers 28% of the total number of patients attending the Aboriginal Medical Service in Redfern. Diabetes is a complex chronic disease that has plagued millions of people all over the world. Specifically, the most common form of diabetes, which is type 2, poses the greatest burden to the healthcare system globally and in Australia. Unfortunately, those who are socially disadvantaged groups, most especially the Aboriginal and Torres Strait Islander Australians, experience more disproportionately high levels of diabetes. They are 3 to 4 times more likely to have diabetes, 4 times more likely to be hospitalized due to diabetes, and 6 times more likely to die due to diabetes. The mortality rates are 6 times higher for Aboriginal and Torres Strait Islander due to diabetes than non-Indigenous Australians. In 2013, statistics showed that diabetes was the second leading cause of death among Aboriginal and Torres Strait Islander people. Diabetes is not only caused by lifestyle, but also historical, social, and cultural factors. Based on Australian history, Aboriginal and Torres Strait Islander were hunter-gatherers up until the late 18th century. However, major turnaround in their lifestyle occurred in 1788 upon the arrival of Europeans. Drastic changes took place from their traditional activities of hunting food and resources for survival, cultural and family practices to their spiritual connection to the country. Changes in their physical activity and nutrition were the contributing factors in the development of diabetes among Aboriginal and Torres Strait Islander people, which was marked in the half of 20th century. Behavioral, biomedical risk factors and health risk factors such as overweight and obesity, high blood pressure, abnormal cholesterol and triglycerides, smoking, inadequate fruit and vegetable intake are a few of the factors that are contributing to the occurrence of diabetes. Diabetes can also be controlled and prevented through community supported programs, and there are prevention and health programs that can actually lead to positive health outcomes. Health promotion is defined by the World Health Organization as a process of enabling people to increase control over their health and its determinants, and thereby improve their health. It is an effective medium of addressing public health issues from individual to community level. It helps to strengthen the existing healthcare system, most especially if combined with multi-sectoral partnership and if effectively utilized and integrated into schools, hospitals, residential areas, and other settings, it will lead to positive health outcomes. The significance of health promotion to Aboriginal and Torres Strait Islander people. Health promotions are intended to protect the health and well-being of Aboriginal and Torres Strait Islander people in all aspects. This encompasses the social, cultural, physical, and economic aspect of Aboriginal and Torres Strait Islander community. These promotions include public interventions like modification in the packaging of cigarettes, healthy lifestyle information packages to address the key risk factors, such as alcohol and substance use among Aboriginal and Torres Strait Islander community, and mass media campaigns. Health promotions were designed to empower the well-being of Aboriginal and Torres Strait Islander people by addressing specifically each of the social determinants of health in order to achieve a well-rounded healthy body and positive health outcomes. Examples of the health promotions that are existing for Aboriginal and Torres Strait Islander are the following. Number one is Quit for You, Quit for Two. This is initiated by National Tobacco Campaign. Aboriginal Torres Strait Islander are the target audience in order to increase their awareness on the effects of smoking, not only to their health but its implications to others. This health program is a component of NTC targeting the pregnant women, including their partners. As a result of this health promotion, positive responses from Aboriginal and Torres Strait Islander community were achieved. It promoted positive attitudes, which lead them to reduce and eventually to quit smoking. Number two is Care for Kids' Ears. The Care for Kids' Ears aim to provide information and resources to be used by health professionals in order to increase their awareness on the rampant ear diseases and hearing loss in Aboriginal and Torres Strait Islander communities. Third is the Break the Chain, which is a specific advertising designed for Indigenous Australians, which is also shown in the mainstream channels. Fourth is the Strong Spirit, Strong Future Healthy Women and Pregnancies. Fifth is the Closing the Gap, which is initiated by the Australian government, launched in 2008. Closing the Gap program has two targets. First is to decrease the child mortality in half by 2018, and second is to close the gap in life expectancy by 2031. Not only that, it is also designed to address the social determinants of health, such as employment and education among Aboriginal and Torres Strait Islander communities. There are current health promotions also that are existing in New South Wales. These are the Aboriginal Chronic Care Program, or ACCP, One Deadly Step, and Auntie Jean's Good Health Program. The next presentation will be presented to you by Hak Shazang, in which she will be discussing the links between culture and Aboriginal and Torres Strait Islander health. Thank you so much.
I'm going to discuss the links between culture and Aboriginal and the Torres Strait Islander health. Cultural beliefs and practices about health issues among Aboriginal and Torres Strait Islander people are based on connection to country and perspectives of health and well-being. This can often influence their connection to health services, and perspectives of traditional medicine can have a significant impact on their attitude to health professionals. None is a central part in terms of Aboriginal and Torres Strait Islander people's well-being. From Aboriginal people's perspective, country refers to everything. It includes people, animals, plants, the traditional land, air, water, the story of dreams. Traditional land is strongly connected to Aboriginal and Torres Strait Islander people's health and well-being. It is considered as a powerful protector that impacts on individual and community well-being. This disconnection from land and culture can lead to extreme distress and powerlessness and poor health and well-being. According to Kisley and his colleagues, they have emphasized the links between Victoria Aboriginal people's connection to country and their existence, articulated by a participant saying, "You can put your trust in the land because it is your ancestors. Your law is going to guide you in the right direction and protect you." Aboriginal perspective of health and well-being is a holistic view. There are two examples that demonstrate the holistic view of health and well-being. The dance of life is an example of Aboriginal people's understanding of health and well-being. There are 5 factors that influence well-being. These factors include physical, psychological, social, and cultural. The second example of a holistic model of well-being is our well-being, which highlights the links between well-being and environmental. The major elements are sense of control, collectedness, traits, history, and relationships with mainstream. Another interesting part of the picture is the background. The top background is Bama Forest, the country that Rambanara Aboriginal cooperative members identify with. The bottom background is Melbourne City. The two different backgrounds represent the conflict that Aboriginal Victorian people find themselves being mobilized but still struggling to connect to their country. The importance of country and a holistic view of health and well-being have a significant impact on Aboriginal people's connection to health services. Aboriginal and Torres Strait Islander people's primary health care include general practices, community health services, and Aboriginal medical services. Aboriginal community-controlled Aboriginal health services is a typical of Aboriginal health services. Aboriginal community-controlled Aboriginal health is set up because it can meet up Aboriginal and Torres Strait Islander people's holistic view of health that is not adequately met by the biomedical mode of healthcare. The objective of Aboriginal community-controlled Aboriginal health services is to deliver comprehensive and culturally appropriate healthcare to community. The comprehensive primary services include home and site visits, provision of medical, public health and health promotion services, allied health, nursing services, assistance with making appointments and transport, help assisting childcare or dealing with the justice system, drug and alcohol services, and provide help with income support. Aboriginal healthcare work are essential in Aboriginal community-controlled health services. They work as culture brokers who assist Aboriginal and non-Aboriginal healthcare providers and organizations to ensure appropriate engagement with Aboriginal people and community, and also cultural mentors to non-Aboriginal health professionals, clinical and mainstream hospitals. They perform immunization, pap smears, and health assessment and engaged in health promotion in clinics. In terms of Aboriginal perspective of traditional medicine and attitude to health professionals, the United Nations Declaration on the Rights of Indigenous People, 2008, Article 24.1 states, Indigenous people have the right to their traditional medicines and to maintain their health practices, including the conservation of their vital medicinal plants, animals, and minerals. Non-Aboriginal health professionals cannot know the traditional healing without possessing this culture and heritage, but should develop an understanding of Aboriginal and Torres Strait Islander holistic view of health and well-being. Western medicine should be partnership with Aboriginal traditional healing practices, so the two systems can exist side by side. According to Dr. Victoria Griffiths, Aboriginal people avoid mainstream health services because they see hospitals as places of dying. If non-Aboriginal people professionals are accepted that knowledge, they may understand the needs of Aboriginal people are different. So I have talked about Aboriginal people's culture and well-being and how they influence each other. I'd like to introduce Carol. She is going to talk about social determinants.
I'll be discussing about social determinants of health which are related with economic and social conditions and their distribution among the population that influence individual and group differences in health status. The determinants of health include biological determinants and behavioral determinants. Biological determinants are genetics, which include sex, age, body weight, blood pressure, glucose levels, cholesterol levels, and birth weight. Behavioral determinants of health include using of alcohol, tobacco, and drug use in the diet. Also, it includes diet, lifestyle, and unprotected sex. Social determinants of health are where the circumstances in which people are born, they grow in, live, and work. These factors are classified into two, which are health and well-being, and cultural determinants of health. Some of the factors of social determinants are: number one, social gradient. According to Richard and Michael, life expectancy is shorter and most diseases are more common for people who are at lower rank compared to people who are at upper rank on the social ladder in the society. People who are poor face more issues and are unable to deal with situation, whether it is materialistic or psychological, causing disease and premature deaths. Education. Number two. According to World Health Organization, education levels are linked with poor health, more stress, and lower self-esteem. Health education should start at early stage of a person's life, as this will incorporate proper and healthy food choices. According to the search, a lack of education and literacy are linked to poor health status and affect the capacity of people to use health information. Number three is stress. According to Richard and Michelle, stressful lifestyle can make people feel worried, anxious, and unable to cope, which can lead to damage to health and may lead to premature death. If a person is stressed for a period of time, person gets more vulnerable to diseases such as cardiovascular, diabetes, stroke, etc. Number four, early life. According to Richard and Michelle, early development and education last a lifetime. If a person does not have proper support emotionally and proper diet, it can affect lifelong health issues due to improper growth during childhood. Slow and retarded growth during childhood can lead to various improper development and function of organs, leading to illness during adulthood. Number five, social exclusion. According to Richard and Michelle, poverty, social exclusion, and discrimination can cause resentment. Due to poverty, not having basic needs, which are food, clothing, and shelter, can lead to various diseases and premature death. Number six is work. According to Richard and Michelle, stress in the workplace increases the risk of diseases. Due to stress, people try to cope with stress by using alcohol, smoking, and drugs, which in turn affects people's health. According to National Census in 2001, the average gross household income for Aboriginal and Torres Island Strait people was $364 per week, which was only 62%, whereas the non-Aboriginal Torres Strait Island people had the average income of $584 per week. Unemployment is number 7. According to Richard and Michelle, job security increases health, well-being, and job satisfaction. Higher rates of unemployment cause more illness and premature death due to psychological reasons, and financial problems both relate to illness. Number 8 is social support. According to Richard and Michelle, social interaction and supportive network provides practical and emotional support individual needs. Number 9 is addiction. According to Richard and Michelle, people tend to addictive things to overcome unemployment and stress. And number 10 is food. According to Richard and Michelle, lack or shortage of food can lead to malnutrition, whereas excess food can lead to chronic diseases such as diabetes and obesity. Depending on food availability and not having enough education, these factors can all lead to diseases. Now I'm going to be introducing my team member Sylvia, which she's going to be talking about cultural competence and safe nesting and midwifery practice. Thank you.
I'm going to be talking about how registered nurses and other healthcare personnel can incorporate the notion of cultural competence and how it can improve the overall health and well-being of the Aboriginal and Torres Strait Islander communities. As you know, Aboriginal and Torres Strait Islanders are one of the most vulnerable populations facing many adversities regarding healthcare. It must become a priority of the healthcare system to overcome those adversities and serve appropriate care to these individuals. Often, Aboriginal and Torres Strait Islanders do not seek help from healthcare personnel regardless of their conditions, as they are subjected to racism and often are stereotyped. A study conducted by Webster, Johnson, Kemp, Smith, and Townsend found that Aboriginal and Torres Strait Islanders expressed feelings of distrust in the healthcare system, which, quote, told Aboriginal people how to live their lives, but had limited Aboriginal leaders or cultural voices. The study also found that the participants described that their feelings was left unheard and that there was a lack in the cultural understanding from healthcare providers. Therefore, to overcome these adversities in reference to nursing will be to educate and employ more nursing staff from the Aboriginal and Torres Strait Islander background, so the patients can communicate with little to no hesitation their healthcare concerns in order to get the best possible management outcome of the disease. I believe that this will be the best way to promote health and well-being of the Aboriginal community living in all regions of Australia, but most importantly in the urban community where diabetes and its related issues are the most prevalent. Furthermore, the continuing education of existing nurses and staffs and the development of communication skills, both verbal and non-verbal, via workshops will be an invaluable asset to provide the best care and outcome for the patients suffering with diabetes mellitus in all regions of Australia, but most importantly in the urban settings like Sydney. Moreover, nurses from Aboriginal and Torres Strait Islander backgrounds can become educators and advocates for their wider community to promote healthy nutrition and lifestyle options which will lessen the prevalence of diabetes in the long run in these vulnerable communities. Also, nurses can visit schools as educators, teaching children how to lead healthy lifestyles and eat a well-balanced diet, which in the future will decrease the risk of diabetes in these communities. Moreover, whilst promoting diabetes risk in vulnerable and utmost risk regions of the community, registered nurses can provide free screening and checkups for the Aboriginal and Torres Strait Islander population in community healthcare facilities with the assistance of government funding. The Aboriginal Medical Services Redfern is a multidisciplinary clinical service which aims to monitor and care for Aboriginal and Torres Strait Islanders with diabetes and other health and mental conditions. The individuals are reviewed by healthcare educators specializing in diabetes care and management, and by general practitioners Then are referred to various healthcare specialists, including podiatrists and the eye clinic, for further monitoring and management care plans. Furthermore, the AMS Redfern, in conjunction with the Royal Prince Alfred Hospital Diabetes Clinic, provides medical review from endocrinology specialists for patients who are unable to control and manage their diabetes and patients with other diabetes and endocrine-related conditions.
For conclusion, cultural beliefs and practices about health issues among Aboriginal and Torres Strait Islander people are based on connection to country and perspective of health and well-being. Social determinants and other factors leads to diabetes mellitus in Aboriginal and Torres Strait Islander people, as 28% of the population are affected. Health promotion are intended to protect the health and well-being of Aboriginal and Torres Strait Islander people in all aspects. This encompasses the social, cultural, physical, and economic aspect of Aboriginal and Torres Strait Islander community. Registered nurses can become educators and teach safe practice to the Aboriginal and Torres Strait Islander community so they can adopt a healthy lifestyle.